Hey everybody, it's Dan with Pain Free You. Topic for this video is, but sometimes physical treatments help, meaning they make me feel a little better. And the follow-up to that is, so how can it be TMS if these physical treatments give me some relief? Very common thought process. So we'll get to that in a minute, but before we do, we'll just kind of pan over here a little bit to the woods. Take a couple of nice, deep, relaxing breaths. Get yourself centered. Notice the safety. You're okay. You're actually okay. No matter what weird sensations are in your body, you're okay. It's great. I'm looking up at the nice fluffy clouds up there. Beautiful blue sky, white clouds. A little bit sunny out, a little bit cloudy. What a gorgeous day. So as you notice your safety and you kind of soothe yourself and bring yourself down, just know that you're okay. So, the topic is going to be, but sometimes physical treatments make me feel better. So, just had a coaching call with somebody very much focused on their physiology. They were told by their personal trainer that they had a pelvic tilt and pelvic pain, right? And so their entire existence for a few years was from seeing all these physios over and over and over again, going through various programs, combination of meditation and physio, and then trying to integrate a little bit of the TMS concepts in there, but still really being focused on, well, if I don't exercise every single day, I'm going to hurt. And she was very well convinced or confused by the fact that if the physical treatments sometimes made them feel better, sometimes gave them relief for a few hours or a day even, then that must mean it's structural. How can it be TMS if these physical treatments gave me relief? And let's flip it. It's temporary relief. So when I was going through my 13 years of pain, laying on the floor, which is a physical treatment, made me feel better. It allowed my body to relax into the floor, my back lose some of the tension and the need to stay upright. That was a physical treatment. It made me feel better. But you know what? When I got off the floor, what do you think happened? I was still hurting. And so same thing goes for massage, chiropractic, physical therapy, stretching, yoga, whatever it may be that you're doing physically. Some people wear a pain patch. And yeah, that may give you some temporary relief. Even some pain meds can give you some relief. But that does not determine whether or not something is TMS or not. Because if you stop the physical treatments and the pain's there, it's TMS. It's either the original classic TMS of distracting you from your emotional world, or it's learned pain, conditioned pain. Pain we expect, pain we fear, so it's there all the time. Neuroplastic pain. And so the fact that your body will respond positively to a physical treatment, but it's temporary, is actually one of the questions in the pain test. Do things like heat, massage, movement give you temporary relief from your symptoms? Well, if you're increasing blood flow to the area, and Dr. Sarno's theory on the oxygen deprivation is true, then anything that would increase blood flow to the area would tend to give you relief. But when you stop doing that treatment and the blood flow goes back to its previously restricted oxygenation, that's kind of evidence that it's all being controlled in the brain and the nervous system, the central nervous system. It's not as a result of the problem. Now back to the lady with the pelvic tilt. She had been convinced by the physios and the doctors and everybody else that the pelvic tilt was the problem, and that she needed to fix that and maintain it and strengthen her core and, stretch here, stretch there, the glutes, the abdomen, everything had to be perfect. Otherwise she was going to be in pain. She actually was given insoles for her pelvic pain and was told that these will help you keep the rest of your body in alignment. And she got into this very much of a nocebo situation where if she wasn't perfect in her physiology, she was going to hurt. She believed that, and her brain believed and interpreted any movement that wasn't perfect to be dangerous. And if she didn't wear the insoles, that was perceived to be dangerous, so the pain came up. And so, what if the pelvic tilt was not the problem, was not the cause of the problem? What if TMS was the problem all along, and that caused the pain, which caused tension and the muscles to clamp up, which caused the pelvic to tilt, right? Maybe the pelvic tilt was the result of TMS and not the cause of her pelvic pain. And for me, I don't know if you guys have seen my pictures, I was all jacked up and crooked. And for me, if my lower right back spasms, it pulls my hips out of alignment, right? No, it pulls the hips this way, which causes my spine to do this, and then in order not to tip over that way, I got to tilt back this way, and my head's off, and I'm all crooked. And so, what if my crooked body wasn't the cause of the pain? What if it was the result of the pain caused by TMS? So if you're getting a little bit confused that, well, maybe if I treat the body, I'll be fine, you're treating the result, you're treating the symptom and not the cause. And so if you've got that, which comes first, the chicken or the egg, I tend to look at muscle imbalances as the result of TMS, not the cause of the pain. So, if you are on the fence about your physical treatments, if you're doing massage, patches, heat, ice, whatever it may be, I don't believe those things are helpful because it confuses the brain. It sends a very strong message to the brain that, hey, this is physical, so there's a problem with your body, and if you don't ice it or put that patch on or do this or do that, you're going to hurt more. And anytime you don't do that, you're going to have this fear that goes, oh, I should have put that heat pack on before I went to bed, and I'm probably going to hurt more. And of course the brain delivers the pain in response to your expectations. So if you're doing some of these treatments, you may want to wean yourself off of them. Do it in a very reassuring way that I don't need this stuff, and I don't care if stopping it makes me hurt a little bit more for a couple of days, but I'm going to teach myself that I really don't need these physical treatments to treat the symptom, because I know the cause is TMS. I'm going to focus there. If the pain goes up a little bit, whatever, don't really care. That's the approach I recommend. Sarno did say discontinue all physical treatments, and he's the original, right? He's the original from the 70s. He figured this stuff out. And he was very clear, discontinue physical treatments. Injections, chiropractic, physical therapy, stretching, all that stuff. Like, discontinue, because you're just convincing the brain that it's in the body. And as long as the brain feels that it's in the body, it's probably not going to let go. So, I do encourage you, discontinue the physical treatments, but do it with love, do it with caring. Don't do it with fear. Know that you're on the right track. Know that your only job is to sell the brain, convince the brain that you're already fine. That's what I was telling this young lady I was coaching a few hours ago, is that your body is already okay. You just don't think it is, right? Relax, you're not broken. You just thought you were. And so her job is to sell herself, convince herself, teach the brain that her body's okay, and that these things like stretches and pelvic tilt and muscle realignments and physio and all those things are not the answer. And so, I don't know. That topic came up today in the coaching, and I felt it was worth mentioning Because I'm sure there are many, many, many of you, raise your hand if you are, that are still applying physical treatments because they give you some relief. But what if those physical treatments were actually keeping the pain persisting longer than they need to? I don't know. It's a good question to ask yourself. Is temporary relief worth trading a quicker elimination of the pain altogether, or the symptoms altogether? I don't believe it is. Temporary relief is temporary. When you get this stuff dialed in and you get these core principles that I teach, that you're actually okay, you feel your emotions, you soothe yourself, you get the mindset right, and then you shift your focus back to living your life. Get those core principles dialed in. Know that it's TMS. Accept it completely. Physical treatments like those I mentioned are not the answer. And the faster you can get these principles dialed in, sun's peeking through the trees, the sooner you're going to get better. So give it a shot. Reassure yourself that you're doing the right thing. Do it with love. Do it knowing that you're going to get better faster this way. And, if you're convincing yourself that the pain is structural because a physical treatment works, at least for a little while, let's reframe that, because that just actually proves it's TMS. Because if that was a treatment, then it would work. It would stick. And if you're stuck there, I would encourage you to reframe it. Shift those beliefs around and know that those physical treatments are not the answer. So guys and gals, love you. Hopefully you found this useful. Comment below, share this. If you're on YouTube, subscribe, hit the bell notifications so you know when a new video is posted. If you're on Facebook and you're not in the group, come on over. And if you know somebody who's struggling with pain, send them to painforyou.com. And I've got that video there that explains kind of what this whole TMS mind-body stuff is all about. So, love you guys and gals, and we'll talk to you soon.